Hi everyone, my name is Caroline and I will be presenting on pesticide exposure among migrant farm workers. So, migrant farm workers are a pillar of the farming community as they help feed America. They provide agricultural economic prosperity in the U.S. by operating the food supply chain and assisting the nation in becoming the most extensive food exporter. The public acknowledges migrant farm workers as essential workers committed to bringing fresh fruits, vegetables, and any other agricultural foods to the tables of American consumers. That is to have food stability. Despite all the beneficial contributions migrant farm workers supply to strengthen the U.S. agricultural industry, they remain invisible to the public eye. The term migrant farm worker is defined as a seasonal laborer who has traveled to participate in farm labor and cannot return to their permanent residence. Data illustrates a majority of migrant farm workers are Hispanic Latino. 65% identify as Mexican, 9% as Mexican American, 9% as Chicano, Puerto Rican, or Hispanic, and 6% indigenous. Among the agricultural industry, this is a male dominated field. Data illustrates that 75% are male and 25% are female Hispanic Latinos. Among the employment eligibility, 49% do not have work authorization. This includes not having the proper work visa documentation or not being a US citizen or resident of the US. 49% of migrant farm workers are between the ages of 25 to 44 years old. The average age is 38 years old. The highest grade completed, migrant farm workers reported to have completed the 8th grade. The use of synthetic pesticides in the agricultural industry has been essential to prevent food production loss, however detrimental among the farm worker community. Seeing that Hispanic Latino migrant farm laborers make up the majority of agricultural worker demographics, they are regularly exposed to pesticides. The National Institute of Health explains that there are three types of pesticides that are used in the agricultural industry. Pesticides are used to kill pests and control certain plants. So the three types of pesticides are herbicides, insecticides, and fungicides. Herbicides are commonly used on the fields and are used to destroy weeds. Insecticides are used to kill insects, and fungicides are used to prevent mold growth. Common pesticides used in labor-intensive states are organophosphates, glyphosates, dichloropropene, metapotassium, and sulfuric acid. There are 4 routes of exposure. According to the National AG Safety Database, pesticides can be entered through orally, dermal, inhalation, and ocular. For example, migrant farm workers can mistakenly drink pesticide products thinking it's a beverages or eating food that has been accidentally sprayed with pesticides. Also, sometimes farm workers are unable to properly hand wash and sometimes they have pesticide residue. So if they're in contact of chewing gum, smoking, or eating foods, they're ingesting pesticide products. Next, dermal exposure. Farm workers can be handling pesticide products, and if they're not wearing gloves, it can lead to skin disease or rash skin irritations. Next, in inhalation, farm workers can inhale these odorless toxic vapors after spraying pesticides onto the fields. Last, farm workers can accidentally spray pesticide onto their eyes, or if they're working on the fields where they're experiencing windy weathers, they can be exposed to what is called a pesticide mist. So, signs of pesticide poisoning. Extensive health research state that pesticide poison resembles flu-like and cold-like symptoms. So in this case, sometimes migrant farm workers dismiss the symptoms as they believe they're experiencing the common cold or the flu, and they do not seek medical attention. Some of the symptoms that include are eye, nose, and throat irritation, skin irritation like rashes, burns, a burning sensation, bumps, headaches, stomach aches, nausea and vomiting, fever, dizziness, tremors, and muscle weakness. In some cases, individuals who develop severe allergic reactions to pesticide poisoning can result in convulsions, or overexposure can lead to pesticide induced coma. So, the health effects. Due to the overexposure to pesticides, the farm worker community can develop short term or acute effects or long term chronic health effects. So, as mentioned prior to the immediate signs, they include skin irritation, like having burning sensation, bumps, rashes, having eye, nose, throat irritation, nausea, vomiting, diarrhea, and so on. Those who've had several years of exposure can develop cancer, fungus on the hands and feet, which eats away their skin. And for pregnant women um, with their children, they can develop birth defects, such as having development delays. So, the social and health disparities in the farm worker community. Among the economic stability, the United States Department of Agriculture Economic Research Service reports that in some states, the migrant farm worker wages varies. So it can vary from $10.80 to $12.32. The individual income yearly can range from $20,000 to $24,999. For the household income include both parents working out in the field. In some cases, sometimes they have their children. It can result to a yearly income of $25,000 to $29,999. They can be paid by the hour, the crop piece, or a combination of both. Um, Migrant farm workers and their families are unable to get public benefits, which include having Medi-Cal, SNAP, which is food stamps, for pregnant women, WIC, and for children, sometimes they cannot get any type of health insurance. Migrant farm workers, they have overwhelming debts to pay. So, for example, as previously stated, a large portion of migrant farm workers are Hispanic Latino, and they reside from Mexico. So these migrant farm workers pay um, what they called coyotes, or human smugglers, to cross the border, and the ranges can vary from $6,000 to $20,000. And they also provide financial assistance to families. So let's say a migrant farm worker can provide money to their family in Mexico or South America. In neighborhood and physical environment, for housing opportunities and transportation for migrant farm workers are very limited in the U.S. Some agricultural companies provide housing for their farm workers. However, these housing opportunities are overcrowded and unsanitary. Housing often lacks access to clean water and sanitation, which can prolong pesticide poisoning for other laborers and their families. Earth Justice published an article which interviewed 10 migrant farm workers, and in one interviewee explained her um, experience of living in a van with her family, and she would have pesticide residue in her van, so she would be inhaling these toxic vapors every day, and that would cause health effects such as breathing problems. Some of the barriers migrant farm workers encounter is fear of deportation and fear of firing due to their migration status, cultural and language barriers, fear of using healthcare due to immigration status, and understanding pesticide dangers. So, in the U.S., it is required to print pesticide labels in English. So, migrant farm workers aren't able to understand what these labels are saying. Among policy regulations, the United States Environmental Protection Agency, or the EPA, the Agricultural Worker Protection Standard, the WPS, aims to protect agricultural workers from pesticide poisoning by providing training and information to reduce chronic exposure. The WPS provides sufficient training for agricultural workers once every 5 years, and it includes information on the health effects of pesticide exposure, steps in reducing risk, and decontamination protocols. These trainings are usually a 20-minute video that is provided in English. Under the Occupational Safety and Health Administration, or OSHA, they provide in-depth training to non-agricultural workers about the types of pesticides or ways to reduce pesticide poisoning among their migrant farm workers. Personal protective equipment, or the PPA, um, is to limit any pesticide exposure. Migrant farm workers constantly handling pesticide chemicals are provided gloves, boots, goggles, hats, and long sleeve shirts. In any case that PPE is provided, migrant farm workers might be hesitant to wear due to weather conditions, personal preferences, and the rate of pesticide exposure. For example, if a farm worker is assigned to spray pesticides onto a specific field on a day that it's 110 degrees, they will not agree to wear a PPE uniform. And in conclusion, pesticide use will continue to be an effective tool in the agricultural industry. For this reason, strategies must be placed to protect migrant farm workers from consistent pesticide exposure. By including community health workers, CHWs, or promotoras de salud, to provide pesticide safety training in Spanish and provide these training in seasonals for new migrant farm workers. This will allow migrant farm workers to understand the dangers of pesticide exposure and help reduce pesticide poisoning. This implementation can provide further research findings on chronic health impacts of pesticide exposure and discover measures to reduce risk among the farm worker community.